Haiti. It's a Carib Indian word meaning land of mountains. And on the afternoon of January 12, 2010, the steep mountains of this island nation are moved by the explosive force of a magnitude 7 earthquake. The destruction is immediate and severe. Entire buildings vanish in an instant. An already crumbling infrastructure is totally destroyed. And the human cost, staggering. The number of wounded and dead, unimaginable. And with no functioning health system, the outlook for survivors is grim. But 1,500 miles to the north, on Manhattan's Upper East Side, a surgeon of Haitian descent at Mount Sinai Medical Center is preparing to move a mountain of his own. Dr. Ernest Benjamin is about to mobilize the full resources of Mount Sinai to bring urgent medical care to his homeland.
That same evening, I had a discussion with Wayne Keithley, the president of the hospital, and he asked me, do you think really there is something we can do? I said, we certainly cannot intervene like the big organizations, but by the time they act, it will probably be too late. There is something that we could do, even if it's small, but it will save life. And he said, go ahead.
Dr. Benjamin arrives 3 days after the earthquake, along with 4,000 pounds of medical supplies. He immediately sets up an emergency operating room and begins treating victims.
We were the first team that arrived at the General Hospital. We had dead patients on one side, dying patients on the other side, and an administration that was completely overwhelmed in the middle. No water, no electricity, no OR that could be used. So we established the first operating room.
We heard from Ernest almost shortly after his arrival that it was every bit as horrific as the reports, and that the situation was going to get much, much worse over the next couple of days, and that although international relief was likely, by the time that relief effort made its way to Haiti and worked its way through the various bureaucracies and relief agencies and so forth, that it would be too late for many people. There was no one really that could bring the sort of focused help that Dr. Benjamin was reporting that he needed on the ground in Haiti at that moment.
Before long, Dr. Benjamin is joined by a relief team of 27 additional Mount Sinai staffers.
We had hundreds of volunteers, but ultimately narrowed it down to a team that was self-contained. So we had surgeons, we had nurses familiar with operating room procedures, we had a communications specialist. So we tried to establish, much like the Army would, I suppose, a unit that was fairly contained, and then give them the supplies they needed to support themselves and then to support their mission.
The scene at the hospital was just of misery and devastation, and people under trees and under sheets that were draped from tree to tree. There was a smell of death and gangrene in the air, and it was really quite a traumatic thing to witness. We all felt it, but in order to function in the environment, you put those things aside and you just focus on what you're doing.
They set up additional operating rooms, implement tracking systems, coordinate patient flow, and they operate. Skin grafts, fracture repairs, amputations.
Most of these patients now were 2, 3, 4, 5, 6 days out from the original injury, which had no primary care to it. And so many things had set into these wounds and these injuries, so you were left in a situation where you sacrificed a limb to save the life.
More than 80 surgical procedures on adults and children. More than 200 people treated in all. After 10 days filled with heartbreak, compassion, fatigue, and even joy, the team departs, leaving behind an organizational structure still in use at Haiti's National Hospital. But their experiences in Haiti will remain with them forever.
This experience changes everybody. It's somewhat of a humbling experience. It takes you back to the reality of what you do and why you do it.
It was an honor for me to be one of the chosen, to be part of the team. That was the best experience that I had in my life, to go home and help, to be part of Sinai, to be part of the team.
Our program and our group was so well staffed and so well organized that we defined our goal, we set in motion what we could accomplish, and we did it.
I'm very, very proud of my hospital.
During their stay, Dr. Benjamin and the Mount Sinai team reinforced the hospital's proud legacy as an institution founded to provide medical care to those who need it most. And in the process, they turned Mount Sinai into a real mountain, a mountain of hope for the people of Haiti.